Thank you for allowing me to speak.
Thank you. Thank you to all of our public speakers this evening. Next up, we will have a presentation to our council and to the community from Marathon, who will provide our year-end review. This is our 10th year that we've been with Marathon, and as they make their way up, we'll be joined this evening by Jennifer McConnell, as well as, I just still got to say, Mayor Morrissey. Also want to note that we have Ryan Brahms from Rockford Brokerage and Consulting with us, who has been our healthcare consultant. And I had the opportunity to see a portion of the presentation today, and I think council and our community will be glad to see that those of our employees who are not feeling well, not doing well, are some of the employees who are getting and are seeing some of the best results. And overall, not only are our employees saving money with the clinic, but our community and therefore our taxpayers are. So thank you both for taking the time this evening. And Alderman, if you have questions as they go, just raise your hand. I'll try to make sure I call on everyone as we get moving through this presentation. I'll turn it over to you guys.
Thank you, Mr. Mayor.
Thank you, Mayor. So it's an honor to be back at City Council Chambers. It's about a year ago that we were here presenting. Tonight will be a similar format. As the mayor said, feel free to ask questions. This is your time. However, in the interest of time, if there's more detailed conversation that you'd like to be in, get an answer to, feel free to reach out to me. You can do it through the mayor, do it through HR and benefits, or else just reach out to me directly. I'm happy to have a conversation. I get to have conversations like this in my current role at Marathon Health across the country. So tonight, Jennifer will really be leading the most of the discussion. I'll provide a little bit of commentary, but what you'll hear from me primarily is just perspective on, frankly, a lot of the great work that the city's doing, leading in almost every benchmark area compared to our averages for public sector clients across the country. And it's frankly a testament to the outstanding work that your HR, benefits, and consulting team has done, and we're honored to be a partner with all of you. Also, just want to do a quick shout out to Alderman Beach and Alderman Frost and Mayor McNamara, who, when we launched the clinic and we're really doing the investigative work back in 2013 and 2014, they were really at the tip of the spear, leading the process and driving this evolution and really innovation when it comes to supporting the health of your people. So with that, I'll turn it over to Jennifer, and again, honored to be here tonight.
Thank you so much for having me as well. Thank you, Larry. So I wanted to start, and not sure if all of you are aware, but just kind of a general announcement. Marathon, at the beginning of this year, announced a merger with Everside Health. Very similar company, do the same thing we do, direct primary care. So I just wanted to make you all aware with the merger with Everside Health, we've more than doubled, and we have several public sector companies and not companies, excuse me, municipalities and school districts, things like that we work with. So we've almost doubled our footprint, which gives us a great insight into what other municipalities are doing, other public sector clients, and allows us to bring those ideas forward and help ultimately drive forward, the partnership we have with the city of Rockford.
And just to add a little bit of commentary to that point, again, I work with our public sector practice nationally. When I first started with Marathon Health, we were serving about 300,000 total eligible employees nationally. Today, just with the public sector, it's over 600,000. Then all combined, public and private sector, it's nearly 3 million patients eligible to use our services. In the public sector, that includes state governments, city governments like the city of Rockford, county governments, also a whole host of transportation authorities, housing authorities, and the like across the country. Again, happy to provide any kind of insight and discussion if there's interest on how we work with various public sector organizations across the country. But again, it's an honor to be able to work with so many public servants.
All right, so first of all, I want to give a shout out first and foremost to our team. So there's a picture of them on the screen there, our medical assistants. We have a new mental health provider, and you all know Anthony and Dr. Dave. Some of them are back in the back. So, we're up here speaking to you, but it's really that team on the screen that does all the work and day in, day out is here to serve the employees, spouses, and dependents of the city of Rockford. So thank you all. Here's our overall executive summary. We'll dig into a little bit of these going forward, but just some high-level numbers for you. The engaged population, if we look at the amount of patients we have that are engaged, which means they've had at least one visit in the past 18 months, 78% of the City of Rockford's employees are engaged in the Wellness Center. Down at the bottom, it's kind of small, but you can see the benchmark for our Marathon public sector is 50%, so the City of Rockford leads our benchmarks in almost every aspect. So we do thank you so much for your partnership and being really a leader and an example for other public sector clients within Marathon. In the past year, this data is from October 2023 through September 2024. So in that year time, we've had over 3,000 visits. 84% of the employees that have either a high biometric risk factor or a chronic condition are engaged in the clinic, so they've come in. Up at the top right, you see 80% of employees that have a high-risk biometric factor are making some kind of progress. So maybe their blood pressure is getting better, maybe their cholesterol, their BMI, but a huge number. Again, our book of business benchmark is 74%. So again, City of Rockford leading the way. Our patient satisfactions, the Net Promoter Score is 85.5, which is an excellent score for healthcare. And then 98% of people that take the surveys say they're either satisfied or very satisfied. And probably the number I'm most excited to share with you is the bottom right corner, the estimated savings. So if we look at how much it costs for members who don't use the clinic, or for who do use the clinic compared to people who don't use the clinic, there's a savings of $2,406 less per member per year. So we actually get your claims from Blue Cross Blue Shield, so we're able to do those calculations and get a hard dollar savings for what we're providing, saving the health plan. And then at the bottom right-hand number, again, another way we estimate savings is we do the trajectory of claims spend. And so over the 10 years, we're about $52.1 million below the estimated claim spend all across these past 10 years. Again, we're not saying Marathon Health has we're not taking credit for all of it. There's a lot of factors. But again, that it's due to the partnership between the Wellness Center and HR and the great programming and all of your support. Just some highlights at a glance. We averaged in this past year 31 new faces in the clinic, with 10 of them being their first visit ever. So there's more and more people coming in new every month. Again, there's that same number, 2406 is what it costs less per member per year for people who use the Wellness Center. 76% of the survey respondents said they spent 5 minutes or less waiting for the provider in the room. 99% spent 10 minutes or less in the waiting room. And then you can see there, 553 people made improvement on at least one biometric risk factor. And then again, with all of that, there's a lower rate of inpatient admissions and ER visits for people that come into the Wellness Center versus those who do not. So one of the new services we added this year was mental health. So Casey Pilcher is our new licensed clinical social worker. She just started with us in August, towards the end of August. And you can see she kind of ramped up in September, October. She's really making some time and effort to get out and meet the departments, show up to department meetings so they can get to know her and feel comfortable, because that's what we've seen even with all of our providers. When we get them in front of people, that's when they feel more comfortable coming in. And once they come in the door, they generally come back. So Casey is here tonight. So thank you, Casey, for being here. There's some direct quotes from survey comments of people who have spent some time with Casey. So super glad to have her and excited to see how this partnership continues as we move forward. The next slide is just kind of a breakdown of the health of your population. So this is a breakdown of those who are at a high risk or they have a chronic condition. So right now there's 776 members, so whether they're employees, spouses, or dependents, that have a high risk factor or a chronic condition. So you can see there, about 25% of the people have multiple chronic conditions, 47% of the people have one chronic condition, and there's about 2% of the people, we have a Johns Hopkins tool, so that estimates that those people will have advanced medical needs. And then 25% of the people have high biometric risk factor. So at our larger presentation this morning, they've asked us to do some comparisons. So we're going to dig in and see how that compares to some other municipalities. But more important than the health of the population is the chart in the middle there that says the percent engaged, because it's one thing to know what the health of your population looks like, but it's another thing to know what are we doing about it. So you can see, if there's one group that we're going to engage less, it's the low risk. That's okay. We'll take that. We would love everyone to come in, but we really want to get those people in there that have chronic conditions, whether they have one or many, or they have advanced needs. So you can see there, 80% of our moderate risk are coming in, 72% of the high biometric risk. So again, I don't need to read it all to you, but basically what it's saying is they're coming in, right? Those are the people that we want to actively reach out to, and we're focusing our outreach efforts on reaching out to those people and getting them in the clinic, because that's when we really start to see A, happier, healthier people, and then B, savings to the health plan. And this is just a breakdown of the chronic conditions. So number 1 is hypertension, 2 is asthma, 3 is diabetes, 4 is depression. We see this all across Marathon's book of business. Hypertension is always number 1, and asthma, diabetes, and depression kind of, those may vary, but those are always the top 4, so nothing out of the ordinary there. Another new service we added with this past renewal was value-driven referrals. So just a reminder of what that is it's a concierge referral service. So when Dr. Bolger or Anthony see someone, they need to make a referral, you need a colonoscopy, or you need to go see a cardiologist, they send the referral directly to our referrals team, and within 24 hours, someone from the referrals team reaches out, calls the patient. They have your health plan, so they know which providers are in network, and they use a tool called Garner Health. Garner has billions of claims, and so what we look for are the providers that have the highest quality outcomes with the lowest cost. So in addition to the good patient outcomes and having that concierge service, we're also looking for high quality care at a lower cost. So if we look at just the procedures saved, there's a lot going on here. These are just procedures, so these aren't all necessarily office visits. So I just want to draw your attention to that bottom line. You can see there were 12 procedures ordered with this. 11 of the members selected the Garner tool. And so over in there in the third from last column, you can see the average cost for the standard market rate is $1,188 for the non-Garner option. And then for the Garner option, it's $773. So those 11 people saved $415 each. So that's a total of $4,500 savings just for those procedures. That doesn't necessarily count the savings by going to the specialist office visit, just strictly procedures, ultrasound, mammograms, things like that. So more to come. This is new data, right? This is a new thing with us with Garner. So as we get more information, we'll be able to provide more savings as we get more data. And then this is what I mentioned at the beginning, our savings of user versus non-user. So on the left-hand side, you can see, again, these come from your claims that we get directly from Blue Cross Blue Shield. The members who do not use the clinic, they're not engaged, they have 0 visits in the past 18 months, cost $9,342 per member per year. And those who are engaged in the clinic, and we're defining engaged in this case as having 1 provider visit. So if you just come in and get a flu shot, we're not counting you, right? Because we're not going to make a ton of difference if you just come in and get a flu shot, but they've had a visit with a provider. So those people are costing $4,936 per member per year. So when you take that out and extrapolate that savings, it comes out to $1.4 million saved. And one other thing I want to draw your attention to is the average risk score down at the bottom below the columns. So the non-engaged, so 1.0 is average risk for a normal individual. So you can see the non-engaged is 1.30, so that means they're 30% sicker than the average person, for lack of a better word. But the engaged group is 1.54, so they're 54% sicker. So sicker we could translate to claims, even though it's not necessarily sickness, right? So we would expect the people who have a higher risk score to cost more, but they're costing less. Again, this is not all due to the Wellness Center, but we like to think that we have a little something to do with that.
Yeah, ultimately, we're actually engaging a sicker population, and having a real positive impact, which is all very good, and it's a testament to the clinical team. So the name of the game then is how do you engage those folks who are not engaged with the clinic? And so that was a lot of our discussion today, is a strategic conversation. What can we do to make sure we're engaging with as many members as we can? Had a lot of really good discussion around that.
And this is the same savings slide. It's just showing that if on the right-hand side, the IP admits per 1,000, that's inpatient, and then the ER visits per 1,000, just showing that we would expect the people with the higher risk score to have higher ER visits and higher inpatient admissions. There was no difference in inpatient admissions, but the ER visits, the rate is lower with those engaged than those with not engaged. And some of that is just having access to a lot of times same day or next day care. It helps avoid those trips to the ER. And then this is the slide we look at every year, the overall go live claims trend analysis. So it's a couple years before we started the clinic, and then you can see that orange line is our projected, what the claims are projected to be. So anytime the purple's above, it's a loss, and anytime the purple's below, it's a savings. So you can see in year 10, the claims were $7.5 million below what they were projected to be. And then if we add that all together, for the past 10 years the Wellness Center has been here, it's $52.1 million below the projected claims spend.
If I can just make a quick comment on that. Back when I was first elected in 2005, quite a few years back now, we were dealing with a health fund that was completely underwater, and it took a long time just to kind of get us back to a baseline. And then the council made the decision to reinvest a good amount of the savings into the health center. The trend line that we're seeing there, again, we were projecting a path that was not sustainable for the city. We've been able to really change that trajectory, and I appreciate as a taxpayer today, I'm no longer a policy leader like yourselves, but as a taxpayer, people might ask the question, why does this make sense for the city of Rockford to invest in this? What's it mean for me as an average taxpayer? All that savings is money that taxpayers don't have to pay, right? You're actually saving taxpayer dollars by investing in the health of your people. And then fundamentally, just one other observation, we have a whole nation that's struggling with trying to address chronic disease, and primary care access has not gotten better. It's getting worse. We have fewer and fewer people going into primary care compared to those that are leaving, retiring, picking a different career path, whatever. And so what you're doing, I think, in terms of changing the trajectory for the city of Rockford, city employees and their families, is also, I think, a great way to lead and show a direction that other employers hopefully can follow in terms of getting away from the fee-for-service model into truly value-based care.
And then this is new. From our merger with Everside, we got a full actuarial team that joined us. So one of the new ways that we are showing savings, chronic condition management. So you can see on the top, the patients, we're looking at 3 metrics: blood pressure, weight management, and diabetes. So we can see that we've improved, 219 of the people have improved, and then there's the annual value per patient. And then over at the top column on the far right, $520,104 is the estimated savings from managing those chronic conditions. So another way that we can look at savings, but probably even a more important way to us going forward, is there's still 507 people out there that are at risk. So if we take that value, there's still $1.2 million of savings out there. So that's kind of the number that we're using to help drive us and engage those people so we can get them in and then see that savings continue. So it's been great so far, but we definitely are not going to rest. We're going to continue to push forward and find additional savings and lead to healthier, happier people. And then we talked a lot about our next steps, continuing. We've got a lot of programming, new programming coming out, continuing our mental health outreach. We've got some diabetes and weight loss programs, really focusing on outreach, whether it's phone calls from our clinical staff, some postcard mailers to the house so we can try and engage some more spouses. A lot of good discussion this afternoon of some things that we want to implement. And that is what we have for you. Any questions for any of us?
Thank you for that. Any questions? All right. Alderwoman Torino.
I don't have a question. Just have more of a testimonial. I was at a street festival this summer, back in June, and I fainted in the middle of the street. And it wasn't just I can't be normal. It was like, Alderwoman. I wish I could be Gabby again. But it was a big spectacle. And I tried to get into a doctor, and honestly, to get, long story short, to even get to a new primary that I needed, couldn't get into a primary until January of next year. So I'm like, I'm just going to go to the wellness center. And I was seen by Dr. Bolger. And as soon as he came, I was like, hey, Dr. Bolger. Just an amazing experience. Like, really one of the first times I've ever been with a physician that really just took time, asked the right questions, didn't rush me through the appointment, just made sure that I just understood things. Like, and he would say something like, do you understand? Do you get it? Like, I just felt like I left so knowledgeable, but I felt actually cared for. So that was just like a wonderful experience. And like, it was a problem that I've had that has just not been properly treated like my entire life. But it was like finally someone took the time to actually care, ask the right questions, get the tests, and like I feel so much better. Like I'm much better as a result of the care from the center. So I just, shout out to Dr. Bolger and also this service. So obviously I've had such a great experience with it. I'm going to continue to support it for the city of Rockford.
Thank you for sharing that.
Thank you so much.
Thank you very much.
Thank you. Other comment? Alderman Frost?
It's been a long time since Mr. Morrissey was mayor of Rockford and asked if I and Alderman Beach would join him and Ryan Bronze, I think it was August of 2013.
He still regrets it.
To go on a trip, and not just one trip, but two trips. We went to Chattanooga, Tennessee. We went to Bend, Oregon, to interview, and we got it down to two finalists. And Marathon was selected to be our first and only wellness partner in Rockford. And I'm very happy to see the high participation rate much above the benchmark. And as Alderman Trina just indicated, anyone that goes to the wellness center as an employee of the city of Rockford sees firsthand how truly great it is. And I think that's a testament to why you have such a high percentage rate. The care that people receive, the items that you look at, whether it be BMI or diabetes or asthma or whatever the case may be, the care and concern is great. And at the same time, as a city that's self-insured, it's nice to see the cost savings that we've been able to accumulate over time. And when you look at it over a 10-year period, it is significant. So I think it's important to know that not only are you helping keep employees healthier and less sick, but you're also at the same time helping our self-insured fund, and as Larry mentioned, frankly, the taxpayers of Rockford are also indirect beneficiaries of this. So thanks for all your work.
Thank you very much.
Thank you.
Any questions or other testimonials, if you want? Alderman Thunberg.
Thank you, Mayor. I would just like to say, too, I was going to reiterate on the cost savings, especially since we're self-insured, but I appreciate Dr. Bolger and Anthony as well for taking time that I've experienced in the past. You don't feel rushed, but what I do really appreciate is the kind of the non-pill pushing, the holistic approach of your lifestyle, your diet, which probably Alderman Frost here could probably take a cue or two from. But that really holistic approach, and they really took the time to really understand and guide on certain avenues and such. So Marathon, I think, has done a great job, and especially those two in particular as well.
Thank you very much.
Thank you.
Thank you. Any questions, comments, concerns? Alderman Durkee.
Thank you, Your Honor. I just also have a quick observation. At least when Marathon was coming, I remember when Larry Morrissey was mayor, he gave a talk at UIC Health and a couple of the deans came up and said, I thought this guy was a lawyer and a mayor. How does he know all this stuff about healthcare? It's very fascinating. What a quick study he was. And no one could disagree with these employer-based health models. They seem to be working all over the place. Unfortunately, I don't work at one. But I just had one quick question. Do you have an outside audit of outcomes like Press Ganey or somebody? Do you hold yourself? Does somebody look at your outcomes as a third party rather than your in-house people?
So we have an actuarial team, as Jennifer mentioned, that looks at our data. We have an in-house team. But frankly, from the standards that are there, we do have a number of our health centers are accredited nationally, and so we have go through that process for NIH. What is it? NIHC? Is that one of the various accrediting agencies? The problem that you run into from, and there's actuarial review that we'll look at from some of like the actuarial table that you saw there and some of the savings. The problem that we run into is that the sort of standard model out there doesn't match up. If there's an outside audit and review program that you're aware of or others are aware of, that we're happy to take a look at it. But frankly, our model is still relatively new. That actually it's part of my job for 2025 is we're trying to see if we can hook up with some research universities to do some peer-reviewed analysis on our work, because it's just there's very limited amount of data in terms of peer-reviewed studies when it comes to this employer-sponsored model. There's a little bit out there, but not much. I think we feel like we're on the cutting edge. We feel like we're frankly ahead of most of the sort of legacy healthcare models that are out there, but I don't know that there's any outside audit program that could look at our data and give us a review. We have had it looked at by sort of our model by some consulting firms like the Aons of the world and some of the other consulting firms that have validated sort of our approach. But in terms of a sort of an actuarial full analysis, I'm not really aware of one, but I'm happy to look into that more in 2025.
Alderwoman Meeks.
Thank you so much. Thank you all so much. I wanted to also agree that the service is wonderful at the Wellness Center, so I appreciate all that you guys do. I'm curious, and I can't remember vividly how this all went down, but I recall sometime last year where we had to take up like additional insurance or something of that nature, where we had to pay an additional amount for like the entire plan. And I really don't recall. Do you recall anything that took place during that time?
So if I had to guess you may be talking about our stop loss insurance that we purchased. Does someone want to, Sheree or Director Hunter or Ryan, would either of you like to? I know enough to be dangerous.
Yes, thank you, Mayor. Yeah, it was this gentleman that I remember now.
Thank you, Alderman. You may be speaking about our stop-loss insurance. So the city buys some insurance for claims on a specific individual that go over a certain dollar amount. And that will be coming through council probably in another week or two. That insurance doesn't really have anything to do with Marathon. And that is, we actually talked about that in our session a little bit earlier. Marathon has been extremely helpful with the bulk of the population, but we still have 7 or 8 claimants, unfortunately, that have some very serious conditions and cost, unfortunately, a lot of money, millions of dollars. And we have insurance for that. Did you have a specific question about it?
Yeah, that was exactly the question. I just wanted to see if there was any tie with Marathon and what was going on there.
I think the tie is that we're trying to stem the tide of people that get to that point. The more that we can interdict these conditions earlier on, the better that they are, right? But we still have people that have organ transplant or unfortunately, some very serious cancers and things like that. They've been here for 10 years now, and in our office, we run the same data, and I think we're seeing enough now where we're starting to notice that the types of cases that are becoming very serious are changing a little bit, right? So we're not, I knock on wood, because things can change, but we're not seeing as many stroke, heart attack, cerebral accident things that we had seen in the past. Is that because we're now focusing a little bit more on hypertension? That's a hypothesis, right? But those conditions seem to be improving. Where we need help is in autoimmune. We need help with diabetes, right? And that is still something that's very, unfortunately, kind of rampant in our group. That's what we're working on.
Thank you so much.
Thank you.
Any other questions? Just again, thank you to the Marathon team. Thank you to Ryan. Thank you to Sharice and our HR team. Really appreciate the great partnership.
Thank you.
Yeah,
Thank you.
thank you
It's
for
an honor.
having us.
Thank you.
With that, council, we're going to go back, do the acceptance of journals. Is there a motion to approve the journal of proceedings for the meeting on November 4th, 2024? We have a motion. We have a second. Is there any discussion? Seeing no discussion, all those in favor say aye. Aye. Those opposed? Excellent. Next, we're going to go to Petitions and Communications and Planning and Development Committee and Alderwoman Wilkins.
Thank you, Your Honor. Item 1, we have a memorandum from Todd Cagnoni, City Administrator, regarding a proposed development agreement with Steiner Electric for the establishment of Steiner Electric Company, Northwest Branch at 4005 27th Avenue, referred to Planning and Development Committee.
Thank you. Next, we're going to go to Code and Regulation Committee and Alderwoman Torina.
Thank you, Your Honor. Item number 1 is a memorandum from Jacob Rubin, Assistant City Attorney, regarding the annexation of 4580 Springbrook Road, referred to Code and Regulation Committee. Number 2 is a memorandum from Jacob Rubin, Assistant City Attorney, regarding the annexation of 5434 North Main Street, referred to Code and Regulation Committee. Number 3 is a memorandum from Scott Capavilla, Planning and Zoning Manager, regarding the final plat of Rock Valley College, Downtown West Subdivision, referred to Code and Regulation Committee. Number 4 is a memorandum from Kelly Noakes, Engineering Operations Manager, regarding a request to vacate 4 right-of-ways, referred to Code and Regulation Committee. And lastly, number 5 is a memorandum from Mike Hackinson, Land Transaction Officer, regarding authorization to place for sale the city-owned property located at 4640 West State Street, referred to Code and Regulation Committee. Thank you.
Thank you. Next, we'll go to Finance and Personnel Committee and Alderman Frost.
Thank you. All these matters will be referred to the Finance and Personnel Committee. Number 1 is a memorandum from John Posey, Rockford Police Department Business Manager, regarding approval and acceptance of the fiscal year 2025 Illinois Department of Transportation Sustained Traffic Enforcement Program Grant Award. Number 2 is a memorandum from Jamie Rott, Water Superintendent, regarding authorization and approval of the IEPA Revolving Loan Fund application. Number 3 is a memorandum from Mike Hackinson regarding the proposed donation of city-owned properties from IDOT to Rockford Complete Streets Project. Number 4 is a memorandum from Todd Cagnoni regarding an amendment to the existing intergovernmental agreement with the Winnebago County for the Reentry Focused Deterrence Program. Number 5 is a memorandum from Faniqua Hughes regarding the approval and acceptance of the Head Start Early Head Start Continuation Application Grant Program Award. Thank you.
Thank you. Next, we'll go to new committee reports, and we'll go to Planning and Development Committee and Alderwoman Wilkins.
Thank you, Your Honor. Item 1, committee recommends approval of the funding agreement with the River District Association in the amount of $30,000 of TIF funding through the East River TIF District to support their 2025 work plan. The legal director shall prepare the appropriate ordinance.
Thank you. Is there any discussion or questions from council? Alderman Bonney?
Thank you. I just kind of went through finance quickly last week. The staff memo notes that the funding source in the funding level in 2020 was $10,000, and then prior to that, it was $30,000. Has it stayed at $10,000 ever since 2020? So this represents the first increase since COVID?
Mr. Cagnoni?
I believe that to be the case, Alderman, and you are correct. During COVID, we dropped the funding allocation for all our business district associations down, and this is the first time the River District has come back since then.
Have the other groups that draw similar funds, Midtown District, Miracle Mile, and I believe Swift, had come forward with similar requests?
Yeah, they have. At least two of them have been approved with Miracle Mile and Swift, and I can't recall Midtown if we've advanced that or if we're still in discussions with them on a proposed work plan.
Okay. And they submitted a work plan that had a $70,000 total. About half of that, almost half of that, was to hire a part-time employee. I was wondering if we know where that part-time employee is going to work. Where are they going to do business? Where are they going to be physically housed?
I don't think
I do not know the answer to that question.
Do we know if that part-time person has been identified already, or if there's, I guess what I'm asking is, are we, by any chance, taking a part-time position at a downtown business or at, say, the CVB and creating a full-time position by funding half of it?
I'm not aware of the latter being the case, and I'm not aware if they're in discussions with anyone on filling the position.
Okay. Thank you.
Any other discussion? Clerk, will you please call the roll?
Turkey. Aye. Toomberg. Aye. Frost. Aye. Torina. Aye. Prunty. Aye. Wilkins. Aye. Hoffman. Aye. Rose. Aye. Beach. Aye. Barrios. Aye. Meeks. Aye. Bailey. Aye. Bonnie. Aye. 13 ayes.
Thank you. Next, we're going to go to Code and Regulation Committee and Alderwoman Torina.
Thank you, Your Honor. I have 9 items. Item number 1, the committee recommends sustaining the Traffic Commission's recommendation that no action be taken on the request to establish traffic control at the intersection of Crosby Street and Old Knolls Avenue. Number 2, the committee recommends sustaining the Liquor and Tobacco Advisory Board's approval for the modification of an existing liquor license to change the hours of operation to Monday through Sunday, 10 a.m. to 2 a.m. in a C2 limited commercial zoning district at 3840 Broadway. The legal director shall prepare the appropriate ordinance. Number 3, the committee recommends sustaining the Zoning Board of Appeals' recommendation of denial for a variation to increase the maximum number of allowed business identification wall signs from 2 to 3 in a C2 limited commercial zoning district at 6001 East State Street. Number 4, the committee recommends denial for the variation to increase the maximum number of allowed business identification wall signs from 2 to 3 in a C3 general commercial zoning district at 8201 East Riverside Boulevard, thus reversing the Zoning Board of Appeals' recommendation for approval. Also want to state that the findings of fact represents the staff's recommendations. On number 5, the committee recommends sustaining the Zoning Board of Appeals' approval for a special use permit for a tire shop, vehicle storage, and auto repair in a C4 urban mixed-use zoning district at 1005 to 1015 3rd Avenue. The legal director shall prepare the appropriate ordinance. Number 6, the committee recommends sustaining the Zoning Board of Appeals' approval for a variation to decrease the minimum side yard setback from 8 feet to 5 feet, 3 inches in an R1 single-family residential zoning district at 3778 Scarlet Oak Drive. Legal director shall prepare the appropriate ordinance. Number 7, the committee recommends sustaining the Zoning Board of Appeals' approval for a variation to decrease the minimum side yard setback from 7 feet to 4 feet and 3 inches in an R1 single-family residential zoning district at 3796 Scarlet Oak Drive. The legal director shall prepare the appropriate ordinance. Number 8, the committee recommends sustaining the Zoning Board of Appeals' approval for a special use permit for a planned unit development consisting of 2 college campus buildings, parking lots, truck training area, and ancillary related design components, including site parking and landscaping deviations from the regulation in an I-1 light industrial zoning district at 311 South Winnebago Street. The legal director shall prepare the appropriate ordinance. And number 9, the committee recommends approval of the amendments to the City of Rockford Code of Ordinances for Chapter 29, Pedal Bar Bus. The legal director shall prepare the appropriate ordinance. Thank you.
Thank you, Alderwoman Torina. Council, there's 9 items before us. Any discussion on those 9 items? Alderwoman Torina.
Thank you, Your Honor. I have a question for number 9. Mr. Bull, he spoke about this, and I thought it was, I really liked the information that he provided because it was some additional information that we didn't have before. But he mentioned that, because I think we were all sort of thinking that it was primarily going to be used for alcohol, but when he mentioned that, you know, it could be kids and it doesn't have to be alcohol involved, did we consider for non-alcohol usage for the bus to be able to go outside of the district? Is that a part of the ordinance?
Mr. Cagnoni?
So as the ordinance is currently drafted, it wouldn't be allowed to go outside the footprint downtown.
I think that's something we should probably maybe consider, perhaps, because, I don't know, I think it's a great idea. If it's not being used for alcohol, why couldn't it go to other places in the city? Is that an amendment I can make?
That would be up to this body, yeah.
Okay, so we'll leave it up to discussion, if there's more discussion, but then once it kind of dies, I can make that amendment.
Alderman Bonney?
I agree. I think that would be a good idea, and since it's not on paper, we need council's permission to.
I believe that's accurate, yep.
Go ahead. I would move to.
Do you want to wait, or sorry, go for it.
Allow the Fifth Ward Alderman to make that motion.
Okay. So I'll make the motion that, how do I want to state it? That if the pedal bus is not being utilized for alcohol consumption, that it should be able to go outside of the social district.
So I have a couple of questions. Thank you for the amendment. Before I ask for the second, I would think it may be wise, and I'll ask staff, and they could disagree with me, but that we ask our staff, our public works team, to take a look at it to find out if there's roads that we don't want them on, and roads that we do. I think it's a worthy change. I just think it's a massive change compared to what's before us tonight.
So should we lay it over? Make a motion to lay it over.
All right, give me 1 second. So we already have a motion on the floor. Staff, what's your thoughts, either Mr. Cagnoni, Mr. Hankins? Would you need time to review, or do you have a thought of what language could be if they wanted to move forward this evening?
So, Mayor, I think it would be a good idea if it's the will of the council to have a much broader footprint, whether that's citywide or if there's some concern on restrictions of roads, that we relook at the ordinance to make some changes. A couple that just come right off to my head. If we're talking about the utilization of the bicycle outside of the social district without alcohol, I think there's other structural changes that we may want to make in the ordinance as well. Like, for example, this very much was structured as a BYOB opportunity as well, and there's a $5,000 deposit. But if it's the desire to allow the pedal bus outside of the social district without alcohol, we really shouldn't apply the $5,000 deposit that we have for other BYOB licenses. So there are probably some other changes that we could make that would be more business friendly, that wouldn't be necessary for the pedal bus outside that area. But yeah, I don't believe there's a big rush to get this done, but we could be happy to look at and come back with some changes that allow it to take place what we understand the intent to be.
Okay.
So Alderwoman Torino, with that in mind, you have a motion on the floor.
So should I just withdraw the motion and then make a request to lay it over? Does that best?
I think that would be great.
So I'll withdraw the motion and then we'll just keep it over for discussion, because before somebody lays it over.
Okay. So further discussion, we have Alderman Frost and Alderman Thunberg.
Well, I was just going to say, I agree, just to lay the matter over. Maybe we could take a better look at if it's going to be used for non-alcoholic purposes, or like, when Alderman Thunberg wants to have a birthday party for his family, where it could go, where it couldn't go, on streets versus paths versus parks or something like that. So maybe we could kind of study that and kind of figure out what would be appropriate for outside of the downtown district we all envisioned. So if we can lay that over, that'd be great. I'll second the motion to lay it over.
Okay. Before we get that, we have a little more discussion. Alderman Thunberg.
No need to wait for one of my family's birthdays to get this underway. So I was just wondering that if the council is in agreement as far as it stands right now without the amendments or such, that I'm just thinking as far as the business owner, if he wants to start getting underway. If then the procedure would be to make an amendment to the existing, if we passed it tonight, and so the business owner can get underway. That's kind of the way I'm thinking. I think there's good intentions with this ordinance, and I agree with, I think, Mayor, you put it very eloquently, and my thoughts on that too. Obviously, we wouldn't want this on certain streets, and I don't think our citizens would want it on certain streets, so that is something to hash out, but I think the Alderwoman of the 5th Ward has good intentions on that, and I would be supportive of that as well, but I just think in the meantime, I think a business owner would probably want to start getting underway with his endeavor. So,
appreciate that. And may delay me and Alderman Frost plan to park in front of your house and pedal bike, but appreciate that. We have Alderman Bonney, then Alderwoman Prunty have comments as well.
So I think I need to go to the health clinic because Alderman Thunberg took the words out of my mouth. I think that makes the most sense, to approve it as is and then amend it later after staff has a chance to dig into this. And, it might take longer than 2 weeks, and that would allow the business owner who's been championing this to continue on with his planning.
Thank you. Alderwoman Prunty.
No, nothing. Thank you.
Okay. Thank you. So before us, I guess council needs to decide if you want to make a motion. I see it as two options. You make a motion and lay it over, and you get the policy and the maps tweaked up for non-alcohol related pedal biking, or you simply move through what I haven't heard anyone have concerns about with as it stands right now, and we come back and make some amendments once Public Works has an opportunity to review potential maps or areas that they can and can't go. I'm assuming getting some assistance from legal on some of that as well. It's really up to you. With no comment, I'm going to move forward with the existing ordinance to move that through. All right. Any other discussion? No discussion. Alderman Durkee.
Thank you, Your Honor. Just a question on the item number, the signage on Mercy Health. Unfortunately, I wasn't here last week. I'm a little bit concerned about denying the variation for having 3 signs on a building. And I think the way I read it, they wanted one on I-90 and a couple on the sides of their parking lot. I believe it's for their new cancer center. The problem I see with this is right now you got 2 health systems competing against each other. I work for one of them. As a matter of, I work for Swedes, so people should know that. You have 2 health systems competing on both sides of I-90, and you got considerable people that are coming up and down there. And I think the signage on I-90 is important as people are getting off. They could see where they, in a sense, need to go. I don't know what the exact wording will be on their sign, if it's going to say Cancer Center or what it'll say on their new building there. But different patients are in different sort of states of mind, and when they're searching through the campus of a hospital or a clinic area. And we had a lady today who got dropped off at the cancer center, was supposed to be in my building to see me. And there's the signage is sort of adequate there. It's not really big and bold. So we see this a bit. And so I would ask that we recommend approval, as the committee has, approval for this extra signage on a healthcare campus to help the patients and such direct themselves on a very, very busy campus over there. So I would like to make a motion to reverse the committee and approve the committee report recommending approval of the signage as was recommended.
Thank you. We have a motion, we have a second to reverse the denial by committee of what was the Zoning Board of Appeals recommendation for approval. So we have a motion, we have a second. Is there any discussion on Alderman Durkee's amendment? Alderwoman Trina.
Can you remind me, this cancer center, is this directly attached to like the big hospital? The Javon, no? Is this
Yes.
separate? Okay, so that hospital is kind of this very large entity that's really kind of hard to miss anyway. Okay, I just want to make sure that's not like similar to like how Swedes does have a separate cancer center, but this cancer center is associated with their larger hospital. Okay.
I just want to make sure I'm correct. Mr. Cagnoni, the cancer center signage as well as the main, what I will call the main campus of
Right.
Javon Bay Health Clinic out there, is that all in one building?
So the addition for the cancer center is connected to the main building through a corridor, but they are two separate structures that are connected.
Thank you.
Thank you for that clarification. Alderman Bonney.
Thank you. So, as I recall, when this went through committee, it did have the ZBA's approval, and it was on my motion to reverse based on the item before this on the agenda, which is the Chase Bank application, essentially for the same consideration that the ZBA denied, which is in the 14th ward, and I agreed with that and supported it. And I think it's hard to say yes to one and no to another. Not that we don't do that, but to do it on the same night and agenda items immediately following each other, which isn't to say that Dr. Durkee isn't making a good argument. I mean, that is a good point. It is a healthcare facility, but I just don't think it's very consistent. And as the 5th Ward Alderman just pointed out, I mean, that's like the hospital on the hill. You can hardly miss it. I mean, granted, the sign, you don't know there's a cancer center there, but I don't know. I'd be inclined to still deny this.
Thank you. Alderman Rose.
Yeah, thank you for allowing me to speak. We've made some of these exceptions for specific reasons, especially around emergency care. I think we made an exception. It was probably about 6 or 7 years ago when I first got in, I think for Swedes for their emergency room. Seeing that this isn't an emergency care, facility, I just find it kind of ridiculous that we make these exceptions because, quite honestly, I mean, I'll just put it out there. Their signs are enormous. They're actually we gave them already an extended amount of space for their signage out there. It's very ridiculous. It's gaudy. It's I think something that's way overdone. I'm surprised there isn't a bust out there of a particular person. But again, it's just, I don't think we need to make these exceptions just simply because it's a cancer center. It's connected to the largest hospital on the hill. So that's my perspective and just wanted to throw it out there.
Thank you. Alderman Durkee?
Yeah, ridiculous is the wrong word. It's kind of insulting to the patients who have cancer, who have difficulty navigating a large campus. Most of these patients are elderly. They get confused in a lot. We have people get confused between my office building and the cancer center at Swedes. Having extra navigation to assist in that is important. The parking lot is large. They have one sign that says a clinic, another sign that says hospital for the guy who, once the statue, I guess. But apart from the sarcasm, the institution's important. The people who are trying to direct themselves on a very large campus, especially coming off the tollway, is important. These are not healthy people. They're not going to a bank. The bank is a very small building, and I understand the inequity, but I'm also advocating for a competitor. So I was one of the advocates when the buildings were in the campus was first put up, because the signage even then was inadequate. So people are despondent, they're elderly, they're getting chemo run into them. It's kind of helpful to see a sign in a building they're supposed to go to when they're in a large parking lot, and they may not know, maybe their first time. So people get confused. Those of us who deal with patients know that they get confused. And asking for extra direction is not a ridiculous request. And to say so is a little bit insulting for the patients who actually need that extra signage and direction.
Well, that got hands up. All right, Alderman Thunberg and then Alderman Bonney.
Well, now that this has come up, and with the bank being also brought up too, I'd like to state that based on proven studies that for elderly individuals, number one is fear of dying, number two is running out of money. So maybe we need signs not only at the hospital, but also maybe at the bank, so they can go there. So I have no issues with additional signage at a hospital. Frankly, I didn't really see any issues with the sign at the bank as well. But for the hospital, I definitely can see that point. Thank you.
Alderman Bonney?
I'm going to move that we lay over item 3 and item 4.
So I have a question, Director Hammer. My understanding is that we had a motion and a second to amend item number 4. Would another motion to lay that item supersede that initial motion and second? Because we were on discussion just for the amendment.
Yes, in this case.
Give me 1 second, sorry. There you go.
Yes, in this case, under Rule 11, with the 2 alderman layover rule, that would trump the motion to amend.
Okay. First night on the job, and she's pulling out Rule 11.
Can we give her the job permanently?
If Nick Myers is watching, look at that. Look at that. All right, so we have a motion, or the motion and second, and just so I'm clear, I know it already went through. Was that item 3 and 4, Alderman Bonney? Okay. He certainly would not be at home watching this on a Monday night. We know he has something better in his life to be doing. Okay, we have items 1, 2, 5, 6, 7, 8, and 9 before us. Is there any discussion on those? Clerk, please call the roll.
Durkee. Aye. Thunberg.
Aye.
Frost. Aye. Torina. Prunty. Aye. Wilkins. Aye. Hoffman. Aye. Rose. Aye. Beach. Barrios. Aye. Meeks. Aye. Bailey. Aye. Bonney.
Aye.
Item number 1, 13 ayes. Item number 2, 11 ayes, 2 noes. Items 5 through 9, 13 ayes.
Thank you. Next, we're going to go to Finance and Personnel Committee and Alderman Frost.
Thank you, Your Honor. Number 1, the committee recommends approval of vouchers in the amount of $8,653,517.66 as approved at the Finance and Personnel Committee meeting held on November 25, 2024. And number 2, the committee recommends approval of the 2025 through 2029 Capital Improvement Program. I place 2 matters before you.
Thank you. Any discussion on those 2 items? Clerk, will you please call the roll?
Durkee. Aye. Thunberg. Aye. Frost. Aye. Torina. Aye. Prunty. Prunty. Wilkins. Aye. Hoffman. Aye. Rose. Aye. Beach. Barrios. Aye. Meeks. Aye. Bailey. Aye. Bonnie. Aye. 13 ayes.
Thank you. With that, we will go to unfinished business, and we'll go to Code and Regulation Committee. Alderwoman Torina.
Thank you, Your Honor. The committee recommends approval of the proposed short-term rental ordinance. The legal director shall prepare the appropriate ordinance. This was laid over from November 18th. Thank you.
Thank you. Council, we have one item before us. Is there any discussion? Alderman Bonnie?
Thank you, Mayor. Since this went through committee, and I've been had several conversations with realtors, including the Connor Brown at the Alliance of Realtors and Neely Erickson, that the realtors, of course, had a lot, along with other groups, had a lot of input on this, and had essentially signed off on this, but by their own admission, they there was an oversight on their part that they think that this that they feel that the ordinance as written is a little over restrictive, and that in that it doesn't really allow for a lot of flexibility for families with the way it's written, with the two occupants per bedroom rule, and that, for example, a family of 5 would technically be in violation of the ordinance if they rented a 2-bedroom home and they had 3 children sleeping in 1 bedroom or 1 child sleeping with the parents in 1 bedroom. Now, presumably, this is all complaint enforcement is complaint driven, and presumably there wouldn't be a complaint, but there's still you have to publish what the ordinance is, and it would create a lot of the concern is that it would create a lot of difficulty if in renting if people were worried about being in violation of an ordinance to do something that they could do in a hotel room. Granted, hotels are not usually operating in residential neighborhoods as this would be, but after having talked with them a number of times, I would move that we amend the committee report for short-term rental ordinance as follows. Change section 12, maximum occupancy, subsection A to read occupancy for purposes of determining maximum occupancy is defined as 2 people per bedroom unless additional per bedroom occupants are the minor children of the renters. And section 12, maximum occupancy, subsection C to read, in no event shall the occupancy of the short-term rental exceed 10 persons, including renters, minor children, invitees, and social guests, regardless of the number of bedrooms. So this would be a very limited revision. It would only apply to minor children, wouldn't apply to, a coach and a soccer team. It wouldn't apply to even a extended family of nieces and nephews, and the 10-person limit would stay.
Thank you. We have a motion. Is there a second? We have a motion out there to expand this to just include additional. Okay. We have a motion. We have a second. Is there any discussion? Alderman Thunberg.
Thanks again, Mayor. I had a constituent reach out, and he does have a family that does come in with 9 kids and 2 parents, or, well, mom and dad, so that'd make 11. So how are we going to deal with that? They do these short-term rentals when they come in, but they would be exceeding 10 people, because in this, that it is not to exceed 10 persons, including renters, minor children also. So I just want to put that question out there.
I think as it's currently written, they would not be allowed under the ordinance. Again, it would be complaint-driven, but as it's currently written, they would not be allowed. Alderman Frost?
I just didn't understand the amendment that was made to Section 12C versus the previous language of the ordinance, unless the one I'm seeing here, the draft version is already changed. I mean, if it just says that no event shall the occupancy exceed 10 persons, I don't know why it has to include any other language. I mean, if it's 10, it's 10. And again, I guess under the hypothetical raised by the hypothetical resident that called Mr. Thunberg from out of town, I guess we don't know if they're going to call the VRBO police or not. I mean, it is complaint driven, so I guess if they had one extra child, I don't know how it's going to be enforced anyway. But if you made it 11, then you're going to have someone else call Alderman Thunberg and say, well, now they now have 12 kids. So I don't know how you get around that.
Thank you. I'll be on speed.
But if anyone can tell me, if you can, Ms. Hammer, if you can clarify the difference in 12C versus the amendment versus before.
Director Hammer?
Maybe I can understand it.
Yes, I think it's just specifying that the renter's minor children are included in that maximum number of 10. I think it was probably implied previously, but now it's just
10.
Explicit
Okay.
in including the renter's minor children in that calculation.
Okay.
Any other discussion? We have a motion and we have a second. We have Alderman Thunberg coming back.
All right, thanks, and I'll just say my piece on it. I would hope that if a family does come in this case, which they do with 9 kids and a mom and dad, that I imagine there's not going to be complaints from neighbors that I'm aware of with this particular family, but I'm using them as an example. But good families that come in, abide by the law, mind their P's and Q's, that are over the 10-person limit. I'm not suggesting anarchy by any means, but for them to come in to our city as visitors with a family of that size, to have the ability to get one of these short-term rentals, be able to go to a grocery store, cook for their family, versus going and renting multiple hotel rooms and probably having to eat out is going to be extremely expensive. I know, Mayor, maybe you do that all the time, eat out with a family every night, but that can get expensive. And so I just hope that we have, as a city, have a little bit of grace for situations like that. Thank you.
Lots of grace for people who can field an entire baseball team. So, all right. Any other discussion? We have a motion. We have a second to Alderman Bonnie's amendment. Clerk, please call the roll.
Durkee. Aye. Thunberg.
Aye.
Frost.
Aye.
Torina. Aye. Wilkins. I'm sorry, Prunty. Aye. Wilkins. Aye. Hoffman. Aye. Rose. Aye. Beach. Barrios. Aye. Meeks. Aye. Bailey. Aye. Bonnie.
Aye.
13 ayes.
Excellent. So we have an amended item before us. Is there any discussion on the amended item? Clerk, please call the roll.
Durkee.
Aye.
Thunberg.
Aye.
Frost.
Aye.
Torina. Aye. Prunty. Aye. Wilkins. Aye. Hoffman. Aye. Rose. Aye. Beach. Aye. Barrios. Aye. Meeks. Aye. Bailey. Aye. Bonnie.
Aye.
13 ayes.
Director Hammer, I don't know what you did, but Director Myers was working on this for a long time, and in one meeting, you just get it all done.
The trend continues.
Okay, with that, we're going to motions and resolutions. We'll go to Planning and Development Committee. Alderwoman Wilkins.
Thank you, Your Honor. Item 1, committee recommends approval of the Commercial Corridor Property Revitalization Program. These agreements will be up to $25,000 each. The funding source is the casino tax revenue and ARPA funds with a 25% cost match from the property owner. Item 2, committee recommends approval of the 2025 TIF Commercial and Industrial Rehabilitation Program. These agreements will be up to $25,000 each. The funding source is TIF funds.
Excellent. We have 2 items before us. Is there any discussion on these 2 items? Alderman Bonney.
Thank you, Mayor. So last summer we had a conversation about when we were entertaining a motion to reconsider how we should listen to staff more and trust staff more. And I really, when this was amended at committee, I don't see a great reason to not support the staff recommendation for a 50% match. I think it's just staff recommendation and just logic dictates that the applicants they're going to be better applicants if they're investing 50% versus, and they're going to be more likely to be able to go the distance of this 5-year forgivable loan. And, at 25%, they're going to be less likely to know how to, have less experience in running a business or managing a business. They're going to be more likely to need extra staff coaching and assistance and guidance, and it's going to eat up staff time and which is a cost to us. I just don't. I don't see the reason for doing it. So I also would move to amend the resolution for the Commercial Corridor Property Revitalization Program as follows. The owner shall be responsible to contribute a 50% cost match toward the eligible program costs, which would essentially be taking this back to what was recommended by staff.
Thank you. So, Council, we have an amendment on the floor. Is there a second? Okay, we have a motion. We have a second. Is there any discussion on the amendment? Alderwoman Meeks.
I just want to speak to the fact that I had a lot of time in between this amendment to speak directly with local businesses in my area, many of which have been in business for a very, very, very long time, and looked at this proposal, and we're very pleased with the proposal, very pleased with the idea of seeing that 25% match allow them to have a little bit more flexibility with their business, which I think would preempt more business growth. So I really would love to see this continue to stay at the 25% that we talked about in the committee, and I thank you all for considering that.
Thank you. Any other discussion? Clerk, will you please call the roll on the amendment by Alderman Bonney to A1?
Durkee. Aye. Toomberg. Aye. Frost. Aye. Torina. No. Prunty. No. Wilkins. No. Hoffman. No. Rose. No. Beach. Barrios.
Aye.
Meeks.
No.
Bailey.
No.
Bonney.
Aye.
Seven, six. Failed.
It failed. 7 noes, 6 ayes.
Thanks. All right, 2 items before us. Is there any discussion on those 2 items? No discussion. Clerk, please call the roll.
Durkee. Aye. Toomberg. Aye. Frost. Torina. Prunty. Wilkins. Hoffman. Rose. Beach. Alderman Beach. Barrios. Meeks. Bailey. Bonnie. Item number 1, 11 ayes, 2 noes. Item 2, 13 ayes.
Thank you. Next, we're going to go to Finance and Personnel Committee.
If anyone needs to take a break, just let me know. I have 22 items, which are more than the number of children Alderman Toomer will be renting his house to.
Order.
Number 1, the committee recommends approval of the award of bid for city yards demolition to N-Track in the amount of $233,871.33. So the contract is through June 1, 2025, and the source are ARPA funds. Number 2, the committee recommends approval of award of bid for Madison Streetscape Stage to N-Track in the amount of $4,531,333.56. The duration is through October 31, 2025. The funding sources are the 1% infrastructure sales tax, the WRIA, and the DCO grant. Number 3, the committee recommends approval award of bid for window cleaning to city facilities to All Window Cleaning in the amount of $36,150 based on unit pricing. It's a one-year contract with 4 possible one-year extension options. Annual price adjustments for CPI will be considered contract renewal only. The funding source is the property fund operating budget. Number 4, the committee recommends approval award of bid for well house number 40 to Showstrom & Sons, the amount of $502,340. The contract is through June 2025. The funding source is the WRIA. Number 5, the committee recommends approval of award of bid for demolition to Northern Illinois Service, Demolition Group 31 to Northern Illinois Service, the amount of $39,917. It includes the properties at 1424 11th Avenue, 2920 Arcadia Terrace, and 1922 South 5th Street. The funding source is the CDBG and the construction services operating budget. Number 6, the committee recommends approval award of joint purchasing contract for turnout gear, advanced cleaning, inspection, repair to fire decks, the amount of $60,500 based on unit pricing. The contract is through the date of award through December 31, 2025, with 3 possible one-year extension options. The funding source is the fire department operating budget. Number 7, the committee recommends approval of award of joint purchasing agreement for the purchase of Honeywell structural turnout gear to Delta Fire in the amount of $425,000. It is through December 31, 2025, with 3 possible one-year extension options. The funding source is the fire department operating budget. Number 8, the committee recommends approval of award of joint purchasing contract for City Hall janitorial services to Bridgeway in the amount of $148,406.04. The contract duration date of award is through December 31, 2025, with 3 possible one-year extension options. Annual price adjustments for CPI will be considered a contract renewal only. The funding source is the property fund operating budget. Number 9, the committee recommends approval of the contract extension for rental of traffic control devices to traffic control protection of Bartlett in an estimated amount of $200,000 based on unit pricing. The contract duration is the final one-year extension expiring on December 31, 2025. The funding sources are various departmental operating budgets. Number 10, the committee recommends approval of award of non-competitive contract for traffic signal electronic equipment to Mobile Trex Mobility in the estimated annual value of $300,000 based on unit pricing. It is a one-year contract. The funding source is the traffic section operating budget. Number 11, the committee recommends approval of award of non-competitive contract for loose equipment and supplies to Air One Equipment in the estimated annual amount of $170,000. It's a one-year contract, and the funding source is the fire department operating budget. Number 12, the committee recommends approval of award of non-competitive contract for Air Cascade system to Air One Equipment in the amount of $63,445. This is a one-time purchase. The funding source are ARPA funds. Number 13, the committee recommends approval of award of non-competitive contract for thermal imaging cameras to Dinges Fire Company in the amount of $79,390. It is a one-time purchase, and the funding source is the gaming tax revenue. Number 14, the committee recommends approval of award of non-competitive contract for fire department stationwear to Uniform Denim in the amount of $125,000 based on unit pricing. It's a one-year contract. The funding source is the fire department operating budget. Number 15, the committee recommends approval award of non-competitive contract for MSA G1 Fire Service Self-Contained Breathing Apparatus, known as SCBA, not SCUBA, to Air One Equipment in the amount of $159,940. This is a one-time purchase. The funding source is the gaming tax revenue. Number 16, the committee recommends approval of award of non-competitive contract for First Due software subscription to Locality Media in an estimated annual amount of $34,728.75. It is a one-year contract with 4 possible one-year extension options. Annual price adjustments for CPI will be considered a contract renewal only. The funding source is the Fire Department operating budget. Number 17, the committee recommends approval and award of engineering agreement for the Madison Street Streetscape Phase 1 to Fairgram in the amount of $275,850. The contract duration is through the fall of 2025, and the funding source is the 1% infrastructure sales tax. Number 18, the committee recommends approval award of engineering agreement for High Crest Multi-Use Path Phase 2 design to Fairgram in the amount of $355,826. The contract duration is through December 2025, and the funding source is the motor fuel tax. Number 19, the committee recommends approval of the resolution for the appropriation of motor fuel tax funds for an improvement under the Illinois Highway Code for the High Crest Road Illinois Transportation Enhancement Program, Phase 2 Design Engineering in the amount of $400,000. Number 20, the committee recommends approval of the award of engineering agreement for 2025 and 6 bridge inspections HR Green in an amount of $225,679. The contract duration is January 1, 2025 to December 31, 2026. The funding source is the MFT tax. Number 21, the committee recommends approval of a resolution for the appropriation of MFT funds for improvement under the Illinois Highway Code for the bridge inspections in the amount of $225,679. Number 22, the committee recommends approval of the resolution for the appropriation of MFT funds for improvement under the Illinois Highway Code for 2025 general maintenance in the amount of $10,013,120.04. I place these 22 matters before you.
Thank you, Alderman Frost. Any discussion on those 22 items? Alderman Beach.
Thank you, Your Honor. Just on number 8 and number 16, number 8 has a 3-year possible extensions of the contract, and number 16 has 4 years.
Yep.
Based on what this says here, is these adjustments will go up based on CPI. Will they go down if CPI is lowered, or does it stay the same?
Director Haggerty.
Yes, sir. Thank you. Generally, they will not. I mean, in my 20-plus years here, we've only seen negative CPI once or twice. Generally, CPI-based contracts, too, are personnel-driven, and we wouldn't expect them to cut their staff pay if there was a reduction in CPI, just like we wouldn't expect to cut our own staff's pay. So generally, if there's a negative CPI, we would not expect a downward adjustment. The CPI and a CPI increase doesn't necessarily automatically give them an increase, but it is an upward limitation on the amount that they can request. So they still have to come to us and request a price increase, and we will only approve a price increase up to the amount that CPI has increased. Nothing above that, unless there's some sort of market-based extenuating circumstances that they can document for us.
Thank you.
Thank you. Any other discussion on the 22 items before you? Clerk, will you please call the roll?
Durkee. Aye. Toomberg. Aye. Frost. Aye. Torina. Aye. Prenti. Wilkins. Aye. Hoffman. Aye. Rose. Aye. Beach. Barrios. Aye. Meeks. Aye. Bailey. Aye. Bonnie. Aye. 13 ayes.
Excellent. Thank you. Next, we're going to move to new business and Planning and Development Committee. Alderwoman Wilkins.
Thank you, Your Honor. Item 1 is an ordinance approving the funding agreement with the River District Association in the amount of $30,000 of TIF funding through the East River TIF District to support the 2025 work plan.
Thank you. One item before us. Any discussion on that one item? Clerk, will you please call the roll?
Durkee. Toomberg. Frost. Torina. Prunty. Wilkins. Hoffman. Rose. Beach. Barrios. Meeks. Bailey. Bonnie. 13 ayes.
Thank you. Next, we're going to go to Code and Regulation Committee and Alderwoman Torina.
Thank you, Your Honor. Item number 1 is an ordinance approving the modification of an existing liquor license to change the hours of operation to Monday through Sunday, 10 a.m. to 2 a.m. in a C2 limited commercial zoning district at 3840 Broadway. Number 2 is an ordinance approving a special use permit for a tire shop, vehicle storage, and auto repair in a C4 urban mixed-use zoning district at 1005 to 1015 3rd Avenue. Number 3 is an ordinance approving a variation to decrease the minimum side yard setback from 8 feet to 5 feet 2 inches in an R1 single-family residential zoning district at 3778 Scarlet Oak Drive. Number 4 is an ordinance approving a variation to decrease the minimum side yard setback from 7 feet to 4 feet and 3 inches in an R1 single-family residential zoning district at 3796 Scarlet Oak Drive. Number 5 is an ordinance approving a special use permit for a plan unit development consisting of 2 college campus buildings, parking lots, truck training area, and ancillary related design components, including site parking and landscaping deviations from the regulations in an I-1 light industrial zoning district at 311 South Winnebago Street. Number 6 is an ordinance approving the amendments to the City of Rockford Code of Ordinances for Chapter 29 Pedal Bar Bus. And number 7 is an ordinance approving the short-term rental ordinance. Thank you.
Thank you. 7 items before us. Any discussion on those 7 items? Clerk, please call the roll.
Durkee. Toomberg. Frost. Torina. Prunty. Wilkins. Hoffman. Rose. Beach. Barrios. Meeks. Bailey. Bonnie. Item number 1, 11 ayes, 2 noes. Items 2 through 7, 13 ayes.
Thank you. Before I ask for a motion to adjourn, just want to say a sincere thank you to Director Hankins and your entire team. That capital improvement plan is incredibly impressive. You just think, and I know council knows this, but this summer alone, you're going to have well over $75 million worth of construction taking place. And that includes major thoroughfares from Auburn Street and 11th Street, Alpine, Mulford, Riverside, Spring Creek, and doubling money into the neighborhoods. Incredibly impressive. And you're doing it while doing 2 jobs. I just want to say thank you and a big thanks and congratulations to your entire team. Alderwoman Meeks, did you have?
Comment, I don't think we did officers report.
Oh, we did not. I'm so sorry.
Thank you so much.
Now we can.
Thank you. I just wanted to comment, you may have seen the signs or the acknowledgement on the billboard at Beth Eden Church off of Pierce and Huffman. They're having their live, Bethlehem Marketplace. Yes, so I would love if you would attend. It's between 1 p.m. and 4:30 on Saturday at Beth Eden Church off of Pierce and Huffman. Thank you so much.
Thank you. Alderwoman Torina.
Thank you. I just wanted to make the announcement that on next Wednesday, December 11th, I'm having a ward meeting for the 5th Ward. It'll be at the Guy Z. Jenkins Resource Center, which is 911 Michigan Avenue, directly across the street from Providence Church. That meeting starts at 5:30. Again, ward meeting next December 11th at 5:30, 911 Michigan Avenue.
Thank you.
To see you there. Thank you.
Alderman Rose.
Yeah, well, this isn't in my ward. I always love seeing this come about every year, and it's very, it gets better each year. There's a group called 815 Shorts that hosts our short film festival coming to downtown Rockford, and that is December 13th and 14th. So there's a whole bunch of information on Plus 7 Company is hosting it, but I'm sure there's even more information on the city website. If you type in 815shorts.com, there's a whole webpage dedicated to it. If you're interested in film or short films, it's definitely worth your while in going. It's something that the organization has been doing now. I think they're in their third year, and it's last year they had some great ones. And just like every year that they've hosted it, it just keeps getting better each year. So if you like film, head downtown on the December 13th and 14th at the Nordloff Center.
Thank you. Alderwoman Prunty.
Thank you. Just wanted to say how much I enjoyed Stroll on State, and wanted to thank the committee, the Stroll on State Committee, for accommodating my very large family as we were on the hayride. We had a great time. There were just so many wonderful things to see and do this past weekend. So, we had the Grinch with us. So, so just was saying just how great a job that they did and appreciated it. They also wanted to just give a shout out to the harp players. They were spectacular. I saw them carrying their harps in, and when they were just some young women carrying those harps, and then when I was leaving, I had a chance to hear them and speak with them for quite some time. So they did an excellent job, and I appreciate it. Thank you.
Thank you. I would echo your comments on Stroll on State. Hundreds of volunteers, tremendous sponsors and donors, and amazing work by the Convention and Visitors Bureau staff. Big shout out to John Groh, Chris and Paul, and the entire team that plays a significant role on putting on that free family fun event. Alderman Barrios.
Thank you, Mayor. I want to echo on what you say. I want to thank John Groh for the grand event, and it's beautiful to see all different type of families come together and really enjoy downtown. It's John Groh did a great job. Thank you, Mayor.
Thank you. Any others? All right. Now I will need a motion to adjourn. So moved. We have a motion. We have a second. Anyone want to discuss it, amend it? No. All those in favor say aye. Aye. Those opposed, have a great night.